Hi everyone, I'm Neel, founder and director of the Clinician Engineer Hub. It's great to be here as part of the Beyond Sciences initiative in Toronto, Canada. I'm also joined with Faisal and Nawaz. Say hello, Faisal.
Hi, everyone. Happy to be here with you all.
Great to have you here, Faisal. So Faisal is our strategy lead from the Middle East region, and he's based at MBRU Dubai. What we're going to do today is talk to you about our network, a world's first, called the Clinician Engineer Hub. So this slide highlights historical medicine, a very famous portrait taken in around the 1800s. And here you can see the interaction very nicely between a physician and a patient. And for the clinicians out there, you probably know, and you've probably been told many times, that the art of medicine is based on taking a history and performing a physical exam. And that is true in many cases. But I'm now going to discuss some of the issues with that approach. So let's talk about the history. We know that the history-taking process is subjective. We are reliant on what the patient tells us. Is the patient being transparent? And we're also reliant on whether the patient actually understands what we're asking them. By that I mean there's been a lot of evidence in the medical literature that says often as clinicians, as physicians, we use a lot of medical jargon. So maybe that's part of the problem. Moving on to the physical exam, even though we've tried to objectify the process, we know that it's not always objective. And I tested this out myself. I asked a group of cardiologists to examine someone with a cardiovascular problem, and I can guarantee you that they all gave me slightly different findings on their physical exam. And then what I'm going to say is, imagine yourself as a clinician being unwell. And I came along as a clinician and said to you, I'm just going to talk to you. I'm just going to perform a physical exam, and then I'm going to say, this is what's wrong with you with 100% certainty. In 2021, would you like that approach? And that's something for you to think about. So fast forward now to what I like to say is real life medicine. And in hospitals all over the world, we actually utilize and we rely heavily on a group of professionals called engineers. And you may be wondering, engineers, what's the relevance of engineering in medicine? Now, engineers, I would say, are the silent workforce, but they work incredibly hard and they help us with diagnosing and managing our patients all the time. Let me give you some examples. The CT scan, designed, developed by engineers, helping us if someone has abdominal pain, we undertake a CT scan. Someone with renal failure or kidney problems, sure, we can give them intravenous fluids, but ultimately they're likely to need dialysis, and a dialysis machine is designed by engineers. As a gastroenterology trainee, we perform endoscopy all the time, particularly for people that are bleeding internally within the digestive system. We utilize an endoscope. The endoscope itself also designed by an engineer. Let me give you some more examples. Particularly timely during COVID-19, ventilators and the ventilatory support systems to help with people's breathing, ventilatory devices designed by engineers. If someone has a cardiac issue, an issue with their heart, we can give them medication to help thin the blood, but ultimately we're going to stent those blocked vessels. And finishing, particularly with surgery, traditionally surgeons utilized their hands alone to help with surgery, but now robotics and robots have come into play to allow for robotic guided and robotic assisted surgery. So what we now have is a new generation, a generation that I like to call the clinician engineer. And for many years, we've had this concept of a clinician by itself, a clinician scientist, a clinician educator, a clinician leader, but we've never had this concept of the clinician engineer. So let me talk to you about that now. As I've already said, engineering solutions guide patient diagnosis and management all the time, but we haven't quite realized that. We haven't quite put the two together, the connection between clinical medicine and engineering. Clinicians obviously utilize these engineering platforms all the time, but do we understand how they work? Have we gained any form of training in these engineering solutions? The answer is no. What I'd like to say is by becoming clinician engineers, we can understand these platforms, we can recognize and appreciate the limitations in the platforms, and then go on to develop better and more innovative solutions for our patients. So here we have it, the world's first, the Clinician Engineer Hub, an international network bridging the gap between medicine and engineering. And what we offer are education opportunities, research opportunities, and industry opportunities for medical students and early career doctors. So here we have it, our first educational workshops. These took place at Queen Elizabeth Hospital, Birmingham. This was all before the pandemic, so pre-COVID-19. But what we decided to do is we moved all our workshops online. And what we did was create webinars where we invited expert speakers to provide us all the necessary information in terms of engineering. So Faisal will show us our webinar slide. And what we can see here is that we had, like I said, experts from all over the world. And the advantage here is that you can get the education completely free of charge. And this is actually really beneficial because often students can't necessarily afford the cost of the education, or they can't potentially relocate to an expert institution. So here we brought the experts to the individual. On to our next slide now. All our educational resources are available on YouTube. And it's great to see that when we started, we had 2 subscribers, but now we have 85 subscribers. So I can show you that definitely that this has value and it's gaining a lot of interest. Our research opportunities. So imagine you're a medical student or an early career doctor, you have a research idea, something engineering based, but you're not sure how to go about doing it, which university could help you, which supervisor could help you. So what we decided to do is partner with all these universities as well as healthcare systems and say, we can offer the necessary supervision and connection in that regard. And if you're interested in a short-term lab-based project, or you're interested in a master's level project, or maybe something as high as a PhD, we can provide that connection. And then just to finish off, industry. So we can innovate and develop ideas within the research labs and that setting, but obviously we want to then translate that idea to healthcare practice. We need industry, and industry partners are coming all the time. Our first industry partner, Cambridge Healthcare Research, based in Cambridge. And our most recent partner is Besta Consulting, based in Stockholm, particularly focused around data analytics and healthcare in that regard. We have more recently been working with Medtronic, and so some more exciting opportunities will be revealed soon. So I'm going to pause there. I'm going to hand over now to Faisal. Faisal, like I said, is based at MBRU Dubai. He's our strategy lead from the Middle East region. He's done an immense amount of work and really supported the network greatly. So we're very honored to have him as part of our network. And he's going to talk to you about some of our achievements and other things that we've managed to do in the time that we've been active. So over to you, Faisal.
Thanks, Dr. Neel. And I think we're just as privileged and honored to be a part of this network and to see phenomenal progress being made in the hub. And this would not have been possible without a strong foundation in the form of our advisory board members who are located in different places and institutions around the world. So having them at our foundational steps at any point in the form of mentoring, contact support, or collaboration has really been a driving force for the Clinician Engineer Hub. Now, this foundation on its own has helped us host and organize events in the form of conferences, with our latest one being the Clinician Engineer Hub virtual conference, which was the largest conference by the Hub. And again, mentioning our network of supporters and collaborators, we managed to bring forward collaborations from academia and industry in the form of speakers from Google Health, Amazon, Microsoft, and many others. This meant that our impact was not only in the form of a virtual conference, but even on social media, where we had about 27 million impressions generated in this 3-day event. And this speaks volumes about how much of an impact we can create if we were to join hands in the form of clinicians and engineers coming together as one community. This also meant being recognized as an association with World Health Organization and having some great people support us in the form of future events and future collaborations, because the world is in a global crisis right now, and the need for clinician engineers is immense. In fact, having such support will give us the innovation we need to bring forward more people, more young researchers and medical students forward. Not only from an industry aspect, but even from an academia aspect, we're proud and privileged to be recognized by the New England Journal of Medicine as a virtual forum discussion was held on the topic of becoming clinician engineers. And this helped us highlight the aspect of the Clinician Engineer Hub through experts and moderators from different fields coming forward and discussing about how clinician engineering can affect the present and the future of how we see healthcare as a whole. This virtual forum discussion on its own had given us about more than 6,000 views, and again is a great example of how clinician engineering is being recognized worldwide. And that also applies to the medical education aspect of it, where the International Association for Medical Education accepted our letter to the editor and a chance to highlight an article that focuses on the future of medical education. This meant that we could give our medical students and young researchers the opportunity to contribute to such research articles. And again, shows how we're driven by research, innovation, and collaborations at the same time. And we don't really stop here. We went forward with being invited as a journal collection for Springer Nature. And this meant that we accept invites through literature reviews, research articles, and commentaries in the theme of clinician engineering through our topical collection on Springer Nature, through the Springer Nature Applied Sciences collection. Now, we recognize and know that the importance of having such events and impact in real life should also translate to the virtual world, being social media in this sense. And living in a virtual world means that we made sure that from the very beginning, our stronghold in terms of our Twitter community gets our engagements, gets our events, and all the updates that we need to bring forward a hub of this scale. And that is where our Clinician Engineer Hub Twitter account helped us engage with the community in different parts of the world. And we urge you to follow and keep up with our updates at Clinic Engine. And hopefully this becomes a platform for more opportunities worldwide. Our partnerships have been very helpful and supportive during this time. And we're extremely grateful for one of our partners here, with being the European Institute of Technology Health Alumni, who have given us the support we need to expand our network into the European region. And this has helped us really learn more about how we can help and create innovation in different parts of the world. Our future plans here involve workshops, international events and conferences, along with a focus on research and industry support. So we're just as excited, and we can't wait to share these updates with you in the coming days. One of our big events and upcoming promising hackathons is the Clinic Hacks Hackathon, which will be hosted on March 13th and 14th of this year, virtually. And this will bring forward innovation and global collaboration to healthcare. So we invite you here to register and be a part of global change in the form of ClinHacks. And we've received enough sponsorship and recognition through collaborations in making sure that this is one of our largest hackathon events organized. For further information, please make sure to check up our website, clinicianengineer.com, and of course, our Twitter account at Clinic Engine. We're more than happy to hear from you and look forward to having you as part of the Clinician Engineer family very soon. Thank you.
Thank you.